Now, I'm going to do a much quicker travelogue through many of the really, really impressive initiatives out of this medical college. And as I go through these, remember what a relatively small medical college this is. Remember the relatively small size of the student body, the relatively small size of the faculty, and feel good, as I do, about how much you are doing on top of delivering an enormous amount of patient care, doing an enormous amount of discovery-based research and translational research. To me, it's really breathtaking and a great honor to be with you today. I really mean that sincerely, because you're doing so much at the same time that education and the rest of medicine, undergraduate and postgraduate, is going on. We're celebrating a collaboration that's 45 years long in Brazil. As Warren mentioned, that we've been 30 years in Haiti. And the longevity, the chronicity of these interactions shows that this is one of those foundational medical colleges that saw this early on as an imperative, a professional imperative. And it's impressive not only that it got started then, but that in an uninterrupted fashion it continues to the present day. This is a collaboration with the Federal University of Bahia and Oswaldo Cruz Foundation, and it involves research and training, and as I mentioned, the collaboration's in its 45th year. There's a variety of infectious disease-related research, as I imagine you know, and it draws, I mentioned earlier, the interdisciplinary aspect. It draws on this broad set of fields running from social sciences, mathematical sciences, of course the medical sciences, and Dr. Carvalho directs leishmaniasis research at an NIH Tropical Medical Research Center at this institution. Our thoughts have been so much with GHESKIO in the last 36 hours or so, and I know you know a lot about it. I just want to remind you that it was, as we talked about earlier, begun 30 years ago this year by Jean-Pape and Dr. Johnson, and the initial focus was pediatric diarrheal syndrome, so still one of the big killers in the world. And this was the first group to document the pathology of AIDS in a resource-poor setting. Think about that when you see the chronology of the work that's going on. It's really amazing. Not that we don't have a huge, huge hill still to climb, but it's amazing that you all have had the staying power to work on this for 30 years. This is a really tripartite mission in Haiti. Clinical services, of course, critically important, but also research so that clinical services can be improved, and training beyond the immediate training of medical personnel. And whether you're talking about rural Iowa, where I spent so much time, and medical care is shared very equally between physicians and physician assistants and nurse practitioners, or whether you're talking about community health workers in parts of the world where there just is no way, no resources to develop a medical infrastructure as we know it in the United States, training broadly in the community is critically, critically important. And there's this integrated primary care, which I know you know a lot about. I had the great honor this summer of visiting Dr. Johnson and colleagues, Rob Peck, Dan Fitzgerald, and others, Beatrice M. and others, at Weill Bugando in Tanzania. The reason I was in Africa was that this year Cornell gave its first graduate degrees on the continent of Africa. And there's a hydrology-oriented program, a program in watershed management, integrated watershed management, being given in coordination with Bahir Dar University in Bahir Dar, Ethiopia. And before I talk about Warren's good work more, I want to just toot the horn of Alice Pell and Tomo Steinhaus and the others who developed this program in Ithaca. The thought was to build capacity in Ethiopia, one of the poorest countries in the world and one of the countries that has enormous problems because of watershed management in its agricultural and food systems. But they wanted to build capacity, so your colleagues went to the World Bank and helped to elicit a loan from the World Bank, but the money, they insisted, should go to the Ethiopians, not to Cornell, and that Cornell would do the project, would deliver the education in situ, so to speak, in Bahir Dar, Ethiopia, and that the eventual plan after several cohorts of masters, it's a Masters of Professional Studies program, is that the whole shoot and match will be turned over to the Ethiopians as an example of this kind of capacity building that I was mentioning to you. So I was able to officiate and give 19 MPS degrees to people who had done their coursework, their field research, and everything in between right there in the local region, and are now highly trained watershed management experts working in the area of the Blue Nile in northwest Ethiopia. From there, I had the great honor of visiting Warren and others in Tanzania. Breathtaking experience. My medical practice was always in congenital heart disease in adolescents and adults, and I never could decide between pediatrics and medicine, so I did what most academics do. I refused to make a decision. You know, that's what academics do, is refuse to make a decision. Now, you ask an academic, except for Warren Johnson, what time it is, and they say, well, it depends what time zone you're in, and we'll have to get a faculty task force together, and depends on when you asked me exactly, and so on. And then about 3 months later, they'll say, when you asked me, it was about 3:15 Eastern time. And so we had a chance to go and visit and see things that I'd never seen before, and I thought I'd seen a lot of medicine. I was part of a medical student group that supported and ran a free clinic in Chicago near Northwestern, and I thought I'd seen all kinds of things, but not the kind of things I saw at Weill Bugando. And those of you who have not had a chance to visit this really breathtaking service and education and research site, I hope you have a chance to do it. There are new efforts afoot between Warren Johnson and Alice Pell to try to, and Dan Fitzgerald, to try to link health and development work with agriculture initiatives. And I'm going to talk a bit more about nutrition a little bit later this afternoon, or this evening, or whatever part of the day it is. There are also at least 2 initiatives in India, and more on the way all the time. And I'm going to talk a little bit later about the emergency medicine training that are going on, that is going on here now. I also want to mention the San Marcos Medical College in Peru, with clinical electives at teaching hospitals in Lima, and possibly research collaborations, especially on women's health issues.